Here we go, Treadwell DPT back again with another anatomy breakdown, muscle by muscle. We've broken down the group as a whole, we've hit our dual joint workhorse, the Rectus Femoris, and now it's time to talk about the big boy of that quadriceps group. That powerhouse on the lateral side of the thigh, we've got the Vastus Lateralis. Vastus lateralis is the largest of those four quadriceps muscles, accounting for about 32% of the total quad muscle volume according to MRI studies. That sheer size means this muscle is a major player in producing the massive knee extension torque that our quads are known for. It's easy to see on a well-developed, strong, lean thigh, and it's doing a ton of work every time you walk, squat, sprint, or jump. All that said, we got a lot to cover, man, so we'll really dive into it. We'll break it down bit by bit. We've got origin, insertion, action, innervation, and of course, a few clinical tidbits. Our Vastus Lateralis has a fairly broad origin, with fibers coming from the greater trochanter, the intertrochanteric line, and the lateral lip of that linea aspera on the femur. We'll quickly highlight that linea aspera here, as a very important bony landmark with a number of muscles that attach to it. So Vastus Lateralis originates on that lateral femur from the greater trochanter and trochanteric line, and that lateral lip of the linea aspera. That vast lateral origin gives the muscle a ton of cross-sectional area and fiber volume, and that's one of the key reasons it contributes so heavily to knee extension torque and overall quad size. Big boy, as we could see. Very big muscle. But to take it a step further, the Vastus Lateralis is also deeply integrated with that deep fascia of the thigh, our fascia lata, especially at our IT band or iliotibial band. Those fascial connections mean that the Vastus Lateralis isn't working in isolation. Its contractile force transmits not just to the patella via the quadriceps tendon, but also into that surrounding fascial network. So it has a huge influence on lateral knee stability, and thus also on the mechanics of the patellofemoral joint. From our broad femoral origin, from our fascial integrations, those Vastus Lateralis fibers travel obliquely down and forward, merging into that quadriceps tendon, just like the other quad muscles. Then, of course, from there, that tendon envelops the patella and continues as the patellar ligament, inserting onto the tibial tuberosity. Got a really good combination here of a broad origin, a ton of fascial continuity, and a strong distal insertion that creates a muscle optimized for producing force across that knee joint. As we noted, that origin, insertion, that structure, it allows for not just pure extension, but also that Vastus Lateralis can be a player in controlling those transverse plane forces and stabilizing that patella laterally during movement. But in way less words, our Vastus Lateralis originates up on the greater trochanter and linea aspera and then travels down to insert onto the tibial tuberosity. No surprises when it comes to function, the Vastus Lateralis is a very powerful, pure knee extensor, generating the force you need to straighten that leg. But as we mentioned, it also plays a key stabilizing role for that patella, especially pulling it slightly laterally during extension. So there's a bit of a dynamic balancing act between the Vastus Lateralis and the Vastus medialis obliquus. If the lateral pull of Vastus Lateralis overpowers those medial stabilizers, we can see altered patellar tracking and potential knee pain. That's one reason this muscle is so often implicated in those discussions of patellofemoral mechanics. We've also got to consider those fascial connections we mentioned earlier. Research suggests that Vastus Lateralis activation may contribute to tibial external rotation via those fascial links to the IT band. In that same vein, it acts as a valuable stabilizer against excessive tibial internal rotation. From a performance standpoint, definitely a prime mover in every knee dominant movement. sprinting, vertical jumping, heavy squats, lunges, and more. And because of its size and fiber architecture, the Vastus Lateralis contributes heavily to peak force production and overall quad hypertrophy potential. Quickly to sum up our function, we've got knee extension and stability, with some rotational activation via its connection to the IT band. Very much like the rest of the quadriceps, the Vastus Lateralis is innervated by the femoral nerve, roots L2, L3, and L4, the main motor supply, the anterior thigh. No surprises there whatsoever. Make sure we've got that one locked in for sure. Vastus Lateralis, just like the other muscles of the quadriceps group, is innervated by that femoral nerve, roots L2, L3, and L4. When we're talking about the Vastus Lateralis, the largest of the quadriceps heads and one of the primary drivers of lower body strength and size, the question every clinician, coach, and athlete eventually asks is, how do we bias it? In theory, if we could bias Vastus Lateralis in our workouts, that could lead to much quicker and easier size and strength gains. So what's the approach? How do we train in ways that emphasize that lateral powerhouse and accelerates that quad development overall? First, it's worth noting that the Vastus Lateralis is pretty consistent in its activation pattern across a number of joint ranges. Even when researchers manipulated hip flexion angle during the extensions, one leg at 40 degrees, one leg at 90 degrees, Vastus Lateralis hypertrophy was pretty consistent, and Rectus Femoris was very greatly influenced by hip angle. That consistency of the Vastus Lateralis is part of the reason it's so reliable. But that's the idea: load it hard, get close to failure, and that's when it responds. We also know that the choice of modality isn't as rigid as we once thought. Recent studies have found that both free weight and machine-based training produce similar regional hypertrophy of that Vastus Lateralis when volume and intensity were matched. So that gives us some flexibility to prioritize safety, access, or specificity without sacrificing results. Where things get a little more interesting is when we start to talk about that rotational component. Research manipulating leg and foot rotation during knee extensions has shown that medial or internal rotation, which you can achieve by pointing the toes slightly inward, can increase EMG activity in both the Vastus Lateralis and Vastus medialis. Meanwhile, Rectus Femoris activity tends to peak with external rotation, suggesting that subtle changes in rotational alignment may shift the balance of recruitment amongst those quadriceps heads. Other research looking specifically at closed chain context, so thinking squats, wall slides, and step-ups, has shown that external rotation can reduce the ratio of Vastus medialis obliquus to Vastus Lateralis. This implies a relatively greater Vastus Lateralis contribution under those externally rotated closed chain conditions. This is definitely an area that would benefit from more research, but a good potential explanation here lies in our Vastus Lateralis fiber orientation and fascial tension. Slight internal rotation of the hip or tibia may lengthen the Vastus Lateralis fibers just enough to position them more favorably on that length tension curve. As we mentioned before, that might increase our recruitment demands. Additionally, fascial connections between the Vastus Lateralis, the fascia lata, and the IT band may experience altered tension or rotation, subtly shifting that mechanical contribution required from the Vastus Lateralis to stabilize that knee and resist that internal tibial rotation. So in that way, internal rotation could theoretically place the Vastus Lateralis under a greater mechanical challenge, not because it isolates the muscle, but because it changes the context in which it operates. But yeah, in short, the Vastus Lateralis' architecture and fascial interactions suggest that rotational angle could be a meaningful variable to manipulate in training. All in all, it's certainly not a definitive science just yet, but the early evidence does align with our anatomical reasoning. And given the Vastus Lateralis' massive contribution to knee extension torque and its 32% share of total quadriceps volume, even small improvements in its activation and growth can translate to significant gains in lower body strength and size. And there it is. There you have it. Vastus Lateralis, the biggest, the boldest of that quadriceps group. Big boy, single joint powerhouse. Key player in the knee extension, a lot more than what meets the eye. Fascial connections, an essential stabilizer for that patella. So doing a ton of work behind the scenes and a very important player in bodybuilding, rehab, and performance. 2 quad muscles down, 2 more to go, much more in store, even more to come. Stay tuned, stay locked. It's Treadwell DPT. I'll catch you next time.